is Lorelei, and in this video I'm going to be demonstrating injections. I'm going to start with this intramuscular injection, so you want to gather your equipment, which I have. So I've got a sharps container, which is just right off camera. I didn't have enough space. I've got some non-sterile gloves here. I've got my gauze and my tape, and then I have a 5 ml syringe, which I will take out of the packaging right now. I also have an 18 to 20 gauge needle. I chose to do a, oops, this is a 27, wrong one. Okay, that is why you double check your stuff. Anyways, I have a 20 gauge needle here, and then I also have some alcohol pads. So I'm gonna go ahead and introduce myself to my patient here. My name is Lorelei. I'm the medical assistant that's going to be giving you your shots today. It sounds like it was ordered for you to get a cortisone shot. Can I verify your last name and date of birth, please? Perfect. And is it okay if we proceed? All right. So I'm going to be giving you an injection in the place that I already chose, and there could be some contraindications, which I will let you know about now, such as soreness or bruising. Do you have any allergies to cortisone? No. Okay, perfect. So I'm going to go ahead and assemble my needle and syringe. In order to keep the needle sterile, I never take it out of the package until I'm ready to use it. Twist that on so it's nice and secure. And then I'm gonna pull back 2 ml of air just for the purpose of the video. I would of course never inject air into a real patient. I'm gonna go ahead and wash my hands and put on gloves. Okay, gloves are going on. Alright, and I chose a nice muscular site for this intramuscular injection. I'm going to go ahead and clean my site with an alcohol pad. I'm going to start at the site and work in a circular motion outward. I'm going to let that air dry. Never blow or fan on the site to dry it. This way you'll keep it clean. And then making sure not to get any contaminants on it. Let it dry all the way because it does burn quite a bit if the needle goes in while there's still alcohol on the skin. When I grab my syringe, I'm going to be using just my index finger and my thumb, holding it similarly to a dart. So I'm going to go ahead and remove my cap, and I'm going to have the bevel facing away from me. And since this is an intramuscular injection, I'm going to be injecting at a 90-degree angle. And I'm going to go ahead and pull the skin nice and taut and do a quick and easy 1, 2, 3. I'm going to go ahead and pull up just slightly on the syringe. As long as there's no blood, I'll go ahead and inject. If there were blood, I would not inject. I'd pull out and start over with a new syringe and needle after putting this syringe and needle into the sharps container. So I'm going to release my medication slowly, going about 1 second per ml. So 1, 2, 3, 4, 5, 6, 7, 8, 9. I'm going to pull out and immediately put the needle into the sharps container. I'm going to take my gauze, go ahead and go onto the site. I'm going to apply pressure, and then I'm going to grab some tape and just apply that over the gauze. gonna get rid of all of my trash. And I'm gonna go ahead and take my gloves off. I'll go wash my hands. And I'll document the procedure in their medical file. All right, now I'm going to be demonstrating a subcutaneous injection. So I went ahead and gathered new equipment. I have some gloves, a 30 gauge needle, a 5 ml syringe. Let me open that right now. I also have some gauze over here, some tape, and some alcohol pads here. So I'm going to go ahead and introduce myself to the patient. Hi, my name is Lorelei. I'm going to be doing your injection today. Could you verify your identity for me? Wonderful. All right, I'm going to be doing your injection. Does that sound right? The doctor ordered that for you? Okay, perfect. All right, we're going to go ahead and continue if that's all right. Okay. Any allergies to the medication you're going to be getting today? No? Okay, just so you know, you could deal with some soreness or other contraindications. All right, I'm going to go ahead and assemble my equipment. So I'm going to put the needle on the syringe, and just for the purpose of the video, I'm going to do 2 mLs of air. Of course, I'd never actually inject air into a patient. I'm going to go ahead and wash my hands and put on gloves. And with my site already chosen, my gloves on, I'm going to go ahead and clean it. You're going to start at the site and go outwards in a circular motion. You want to go ahead and let that dry completely. You don't want to fan it or blow it for it to dry, just let it air dry. Unlike intramuscular injections, I'm going to be kind of pulling the skin together rather than pushing it apart. I'm also going to be injecting at a 45-degree angle instead of a 90-degree angle. So I'm going to go ahead and remove the cap. Oops. Remove the cap. And like I said, I'm going to go ahead and scrunch that skin this time. I'm going to go in at a 45-degree angle with the bevel facing away from me. So 1, 2, 3. I'm going to go ahead and inject. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I'm going to go ahead and immediately withdraw and throw it into the sharps container. I'll go ahead and take some gauze, place it over the area, and I'm going to put some tape on top of that. All right, once that's secure, I'm going to go ahead and clean up my garbage. And I can take off my gloves. I'm going to go ahead and wash my hands. And then I'll document this in the patient's chart.